Our guest for today is a heart surgeon at one of the premier hospitals in the country. His team has accomplished many pioneering achievements in treating heart diseases, and because of his notable achievements, he was awarded as one of the outstanding young men for 2013. Please welcome Dr. Karl Michael Reyes. Good morning, Dr. Reyes.
Hi, good morning.
Good morning.
Thank you for joining us this morning. And first of all, congratulations for your TOIM award. And it's
at a very young age,
At a very
too,
young age. And I'm sure you're very proud and very elated that the pioneering works that you and your team have done were recognized.
Well, yes. Well, first of all, thank you for having me here. The award itself, I guess, was something that was given to me mainly for my work with children with congenital heart disease, and I'm bringing for one, it was pretty much bringing the cost of heart disease for children, making it reachable for those who cannot afford, and also, I think also, as you said, for the pioneering works, for the things that we are able to do now that maybe in a few years ago we were not able to do. So that's mainly what the award was for.
Yeah, Mitzi and I, what we were talking about,
we'd like to understand.
We'd like to understand more about
this. You did hybrid. This is the first of its kind in the country. You did hybrid transplants. Can you tell us more what that's?
It's more from. It's not as technical as you think, actually. Yeah. So what they're referring to actually are these. They're called hybrid surgeries. So hybrid surgeries basically combine surgery with another procedure. For example, an intervention in the cath lab. You do it at the same sitting, mainly to make the surgery simpler. So you do what's difficult to do surgically, you do it as an intervention. For example, like you place a stent, and then the one that requires surgery, then you do it at the same time. So that's what they call hybrid surgery. Right. So what we did was for hypoplastic left heart syndrome, and also for other, you can use that also for other types of defects, is to combine those procedures and make them, and in pediatrics, it's really very pioneering here in the Philippines. And it's really to combine those procedures and make it easier for the patient, easier for the doctor.
Minimally invasive.
Less invasive.
Less invasive.
Yes.
Right. Now, not everybody has access to this kind of treatment because it's very expensive. And earlier you said that you wanted to make it more accessible.
Unfortunately, I think the healthcare infrastructure, as we all know, really there are many ways to make things better here in our country. And I think, of course, there is no procedure that is without cost, and there is no procedure that I guess what I can say is that you can make these procedures more reasonable in terms of cost if you can make it more available, I guess, and
how can that be done?
There's this thing that they say you call economy of scale. So as progress, as more procedures are done, as progress occurs, then I guess it brings down the cost in general, right? Another thing is there are many programs, there are many social welfare programs available in our country, and I think they're all, it's very easy. I think if you think about it, children are easier to, it's easier to get treated when you're a child because a lot of people, there is a lot of impact on that, right? So,
okay. I was always thinking that if it's a child, it will be more complicated. But you're saying that in terms of heart diseases, it's always best to be to know it at an early age so you can fix it.
What I meant to say was that there are many donors out there who actually they feel more for children. So it's easier to be able to treat children sometimes because there are people who really care about children getting better. Right. In terms of complexity, unfortunately, heart disease in children is actually a little bit more complex. So it does take a little more to do this, and it does take a lot of hard work and a lot of training and experience to be able to do complex heart surgeries in children, especially. And I think more important than that, because everybody can study for this, it's also dedication and really having a goal, having an advocacy, and wanting to do something.
What are statistics for Filipinos? Is it rising for cases of heart disease? We seem to see it a lot, especially during holidays, with congenital heart disease.
Well, for the acquired types, for heart diseases in general, I mean the ones that you and I may have at some point in our lives, a lot of people say that heart disease is something that you encounter in the first world population. So you can see it in two ways. You can see it as our country is improving economically, and now infection is becoming less of a problem, and now you're seeing the problems of diseases that first world countries have. So So you can see it that way as progress, right? But at the same time, we have to also be up to the challenge. We have to be able to take care of these patients appropriately, and we have to be able to meet up with the demands and be able to make available treatments, you know, for these types of problems.
Well, if I may ask, well, speaking of challenges, it's quite a challenge getting to where you are now. No, you've had training abroad. You went to Harvard School, medical school. I think when that kind of expertise is not very, I guess, prolific around the Philippines, so you're also trying to do training courses for Filipinos.
Well,
right?
we want. When you think about training in the Philippines, I think it should be in a broader perspective. Not only the doctors. I mean, we have many good doctors who have come from abroad, who have come home and doing a lot of good things. And there are many good doctors here in our country as well.
Some of the best.
Some of the best who by experience have made many milestones and landmarks here in the Philippines. But overall programs, you know, what we can take from abroad really is the system. It's the program of the way things are done and in large centers, you know. So similarly in St. Luke's, I think that's how they tackle that problem. They try to not just emulate, but try to develop a system, a program that makes everything more cohesive, more collaborative. And I think that's something we can take from over there.
So you don't have to like go abroad for a treatment and just do everything locally.
Well, that's the goal. We try that. We try to get there. Yes.
Oh, okay. We're getting there.
I think. Sorry.
Well, in 2014, what are we? What
can we look forward to?
Are there like something like new, exciting, promising gadgets or equipment or new tests which we will be seeing here in our country?
In many ways, like as you said, there are many ways that we have already gotten there. I think in terms of treatment, especially in heart disease. For example, in St. Luke's, they have treatments for atrial fibrillation where you can do it catheter-based now. So now we're no longer reliant on medications. But last year, yes, you insert the catheter into your groin, into the artery in your groin, goes into your heart, and it actually ablates the places where the irregular heartbeats occur. Yes. So we have these hybrid surgeries now, and we have this new therapy. It's called ECMO. So it's called extracorporeal membrane oxygenation. It can keep you on life support. Can keep your, if let's say your heart or your lungs stop working for a while for whatever problem, let's say you have a bad pneumonia, like, you know, there's this, remember a long time ago, there was this H1N1 scare, and then all these lungs started to have very bad pneumonias, and the ventilators would no longer work. So then the ECMO therapy became the treatment for that, and now over the last few months we've been able to acquire things like this to help in the treatment of very sick patients.
Is it easier now to detect diseases with this new technologies?
Well, as the old adage is always, an ounce of prevention is worth a pound of cure. So if you can detect these problems early, if you actually, for example, I mean, a lot of us, we are very concerned with fitness. We try to...
it's usually about just losing weight, but not much about the cholesterol level,
or
if the uric acid
is
high.
So diet is important. Exercise is important, but also I think just as important as we get older is really having your annual checkups and really making sure that your blood tests are okay. You may think that your cholesterol is normal because you're eating a healthy diet, but then because of your family history or whatever reason, your cholesterol level is high, then this needs to be treated because this can be a risk factor for heart disease. So there are many, I guess, as I said, it's really more of prevention, and that would help a lot in
right, and this is always part of New Year's resolutions.
Absolutely.
Better health. I'm not going to eat all that.
Absolutely,
you know.
I'd like to lower my bad cholesterol, lower my uric acid. Well, anyway, but Doc, what is your hope for 2014 in the field of medicine here in the Philippines?
Well, definitely, my hope is definitely more progress, more improvements in our healthcare, infrastructure. In the way we treat patients. I hope that things get better. I hope that our needy and our sick, for example, the ones who are affected by Typhoon Yolanda and everything, I hope that we're able to to make progress on all those fronts. I think that's
and this is what your work is doing. So thank you very much.
Thank you
to you and your team.
Thank you so much for joining us also this morning and sharing with us a bit of health news for
Thank you for having me here.
And congratulations again.
Congratulations to you and your team.
Thank you.
Thank you. That was Dr. Karl Michael Reyes.